Okay, somebody in my comments was recently asking if I am still able to work as a chronic illness patient, and I wanted to answer that question. I typically reply to comments with a video, but I can't find the comment, but I know somebody asked this, so I hope this finds you. So if we haven't met, my name is Heather. I'm a chronic illness patient. I have Sjogren's, lupus, and vasculitis, along with a couple of other chronic pain conditions, and I share my story on this app to help other chronic pain patients. I was able to work a full-time job up until 2017. A couple of years prior to that, I had been diagnosed with Sjogren's and vasculitis, but I got it under control and had a pregnancy. After that pregnancy, my son was born, and when he was 4 years old, I got pregnant again, had a miscarriage that sent my whole body into a downward spiral. The hormone changes from the miscarriage, along with another trauma that I had about 6 weeks after that miscarriage, caused my autoimmune disease to go completely haywire. And at the end of 2018, I was diagnosed with lupus, and I had to go off of work completely onto a long-term disability program with my employer. At that time, when I went off work in 2018, I was basically bedridden. I had difficulty chewing my food, difficulty getting in and out of bed, difficulty getting dressed. My husband was my primary caregiver and would often just leave food on my bedside table if he had to leave or go out to work. I have improved significantly since that time, but not enough to be able to go back to work at any capacity. I still have multiple doctor appointments in a week, which includes physio for dealing with my chronic joint and muscle pain, seeing my family doctor and specialist to manage my Sjogren's and lupus. Not to mention things like going to the dentist and the optometrist and ophthalmologist to manage my eyes and my mouth with Sjogren's as well. It's just like a never-ending cycle of doctor's appointments. I have considered going back to work like so many times. I desperately want to. I loved my job. I loved the money that I made with my job. I am bored and sick of my broken body, and I just want like a nice, healthy distraction, and work would do that for me. But my health is still too inconsistent for me to be able to work and be able to take on a project that had any sort of deadline. So I wouldn't be able to really work in any capacity in the way that I did before. Anyways, so for the individual that was asking if I'm still able to work, that is my history with working and disability and what I'm currently dealing with.